Hi, good evening. We've gathered today here to talk and discuss about road safety program. Unfortunately, accidents do happen, but we should also be aware about what our responsibilities are if we come across an accident case in front of us, how we can mobilize our resources, whatever we have, in better management of these accident victims right at the site of accident, and also how to transport them very safely to the nearest trauma centers. And then, of course, you should also be aware what happens afterwards in the trauma center. So there's a role to be played by every common person, and also every department, whether it's a fire safety department or the police or the traffic guards. So all of them have got a role to play, and of course some roles will be played by other helpers from in the area, but doctors, nurses and the technicians and the emergency departments will have the major role to play here.
Nowadays, sir, the accident is increasing too much high. Is there need too much emergency facility like local hospital, corporate hospital, etc., etc.?
Yeah, so there is no doubt that the accident and emergencies are increasing. We have also seen a different trend of the accidents. Before, we would see more accidents which were low velocity. Now we see high velocity because speeds are increasing, roads are getting bigger, roads are getting broader, and the traffic is moving faster. So I think this is an unfortunate corollary to this development project. We will see this more and more. We will also see more accidents from fall of heights, because now we have very big buildings coming up. So you'll also see people falling from height. People have gone into sports, into adventure sports, so you will see many accidents happen from the sporting point of view. So all these are going to happen, and unfortunately when these things happen, we should be ready with infrastructure. Also, what we are doing, there's a lot of new developments which are happening both in initial management and also in the final management. I'll let my colleague Dr. Kushava talk about those aspects.
So what sir I actually told that initial management which is most important. Once the patient is reaching the trauma care, the first thing which I have already explained, the first thing to be done is according to the ATLS score, that's airway, breathing, circulation, then primary screening of the patient. What is the primary screening of the patient is being done. Then after care is done by the trauma surgeon, what as sir has explained, that all the teams should be present. If the patient is having abdominal injuries, your general surgeon should take care of it. If his patient is having a cardiac injury or a thoracic injury, then your cardiac surgeon should be there available. And trauma surgeon, as upper limb and lower limb surgeries are required, the trauma surgeon is nutritional support. What in our lifestyle, what we are not doing we are not taking proper medications, not taking proper supplementation of calcium and vitamin B12 and D3, that causes bones to weaken and causes osteoporosis before our aging, and it causes osteoporotic fractures. So all these factors should be taken care of to prevent osteoporosis and thus leading to osteoporotic fractures.